Hi, welcome to Health and Science Channel. Today we are going to talk about the importance of vitamin D. So let's start. So what is vitamin D, and how do we make it? This step-by-step process. Vitamin D is a prohormone, a fat-soluble molecule that is present in our skin in the form of cholesterol, 7-dehydrocholesterol. When the sun hits the skin, the ultraviolet B, UVB, energy converts the precursor to cholecalciferol, also known as vitamin D3. It is this form of vitamin D that circulates in the bloodstream and is also produced as a supplement. However, supplements can be produced as vitamin D, D2, mainly from plants, or vitamin D3 from animal sources such as liver and fish. Why is vitamin D essential to our overall health? Well, vitamin D has many vital roles. Among them is to help regulate the amount of calcium and phosphate in the body. These nutrients are needed to keep bones, teeth and muscles healthy. Without sufficient vitamin D, bones can become thin and brittle. A lack of vitamin D can lead to bone deformities such as rickets in children and bone pain caused by a condition called osteomalacia in adults. So, what are the other functions of vitamin D? 1. Supports a healthy nervous system. 2. Supports and strengthens the immune system. 3. Supports lung function. 4. Supports brain function. 5. Regulates insulin levels. 6. Improves heart function. 7. Enhance brain development. 8. Strengthen muscular function. 9. Provides anti-cancer effects. 10. Supports colon health. What are the symptoms of vitamin D deficiency? Trouble sleeping, fatigue, frequent cold and flu, weak aching bones, increased infections, loss of appetite, digestive problems, muscle twitching, depression, mood changes accompanied by overwhelming feelings of hopelessness and sadness, forgetfulness, loss of interest in activities that you previously enjoyed, anxiety. Benefits of vitamin D. 1. A sufficient level of vitamin D reduces the risk of multiple sclerosis. A comprehensive review 2018 of population-based studies investigated the correlation between vitamin D deficiency and multiple sclerosis. They found that low levels of vitamin D are linked with an increased risk of MS. 2. In addition to its effects on calcium and bone homeostasis, vitamin D modulates innate and adaptive immune responses. Therefore, deficiency in vitamin D has been seen to be associated with increased autoimmunity and susceptibility to infection. 3. Researchers have reported that many people with depression have low vitamin D levels. Studies have shown that vitamin D might play an essential role in regulating mood and decreasing the risk of depression. 4. Another study found that the symptoms and severity of pain in patients with both fibromyalgia syndrome, FMS, and chronic widespread musculoskeletal pain, CMP, were reduced for those receiving vitamin D supplementation, according to a study published in Nutrients. Results were especially significant in those who were vitamin D deficient. 5. Vitamin D is also involved in the pathways of production of melatonin, the hormone involved in the regulation of human circadian rhythms and sleep. A cross-sectional study reported that vitamin D deficiency correlated with poorer sleep quality. In 2020, a randomized clinical trial conducted by Vital involved more than 25,000 men and women investigated reduction in cancer death in the vitamin D and omega-3 trial, Vital, with an evaluation of whether vitamin D reduces the incidence of advanced, metastatic or fatal cancer. In this clinical trial they found that supplementation with vitamin D reduced the incidence of advanced, metastatic or fatal cancer in the overall cohort, with the strongest risk reduction seen in individuals with normal weight. Now, let's look at the food which are good source of vitamin D. The best food sources of vitamin D are oily fish, such as cod liver oil, salmon, swordfish, tuna fish, sardines, Other foods includes dairy and plant milks that are fortified with vitamin D. Beef liver. And drinks, fortified with vitamin D. What is the recommended intake of vitamin D supplements? According to the National Institute of Health, the RDA of vitamin D for adults is 600 U per day, but several factors may affect your recommended intake. Talk to your doctor before you start taking any supplements. It is not advised to take more than 100 micrograms, 4000 U, of vitamin D a day as it could be harmful. Children aged 1 to 10 years should not be given more than 50 micrograms, 2000 U, a day. Infants under 12 months should not have more than 25 micrograms, 1000 U, a day. Thank you for watching. I hope you liked the video. Subscribe, like and share, and see you next time.